Welcome, Pathfinders and community navigators. I am Marie Corbin, and this is Pathway to Wellness, navigating our journey in our global to local health support. Update. Today, I want to offer a short educational update about some recent Supreme Court decisions in the U.S. on birthright citizenship, transgender athletes, and girls and women's sports and voting rules, and how they connect to the work we do around the safety nets, home, and health. This is not about telling you how to vote or what to think. It's about helping you understand how big legal decisions can quietly change the systems that shape our everyday life. In section one, I'm going to talk about birthright citizens. There are three sections and they're about a minute long, so this won't take long. First, let's talk about birthright citizenship. The basic idea of birthright citizenship is simple. If you are born on U.S. soil, you are a U.S. citizen. That principle has been part of the country's legal foundation for a long time. Recent court decisions have challenged and clarified how birthright citizenship is applied, especially for children born in the U.S. whose parents are undocumented or have temporary immigration status. And for many families, this created fear that their children's citizenship could be taken away or questioned. The latest ruling has kept the core protection in place. Children born in the United States remain citizens. That matters, especially when it comes to accessing schooling, work, healthcare, and stability. However, safe families feel in that status still depends on like how immigration laws and enforcement are handled in different places. So even with this protection, many families continue to live with a lot of uncertainty and stress. Section 2, transgender athletes and state differences. So you do need to understand the difference. So I'm going to go through that really quick. There has been a major decision about transgender girls and women participating in girls and women's sports. The court has said that states may pass and enforce laws that limit participation based on sex assigned at birth. In practice, what does this look like? Well, it means that some states can legally bar transgender girls and women from competing on girls and women's teams. Now, for us in California, it's important to know that this decision allows states to have bans, but it does not require all states to ban. California policies continue to allow transgender students, athletes, to participate on teams that match their gender identity. From a health and safety net perspective, this matters because sports are more than competition. They can be a source of belonging, mental health support, scholarships, and safety. When young people are excluded from those spaces, especially in states that use bans, it can increase isolation, stress, and risks, particularly in transgender youth. We look at this through a wellness lens, as we do for everything we do here at Project Heal Santa Barbara County. And we look at this through the lens of who has access to supportive environments and who is pushed out of them, right? That question connects directly to our work on safety nets and like our series we're doing right now, Home is Health, because if we're tying that into if you have a home, then, it ties into your wellness, right? Now, section 3, voting rules and who gets to get heard. Now, this is important. I want to briefly mention voting rules and representation, not because we're a proponent of politics, because we're a nonprofit organization, but we just want to just kind of give you a little idea of what's going on. Now, the changes to voting laws and court decisions about how elections are run may sound very technical and far away from everyday life, right? Especially for busy people who are out there working. But they matter because they influence who is able to participate in decisions about housing, health, education, safety, justice. I mean, the list goes on and on and on. Income, right? When it is harder for communities facing unstable housing, low income, discrimination, and who can vote, it becomes harder for those communities to shape their policies that's going to affect their safety nets. Our work does not tell people which candidate to choose. Instead, we focus on helping people understand that access to the ballot and fair representations are part of the larger system that determines whether safety nets get strengthened or weakened over time. Now, we're on section 4, the last section. So, how does this relate to me? And how does this relate to global stuff? And how does this relate to global to local support? Well, um, from to our global to local support focus here at FOSBC, the health perspective, we know that social determinants of health, things like housing, legal status, discrimination, access to schools and sports, and participating in decision making, that all plays a huge role in health and well being. Supreme Court decisions shape those determinants of health that we talk about all the time at a national level. See, that's where we come in, right? Because it starts at a local level, but it goes to a national and state and federal level. State laws and local policies then interpret and apply them on the ground. Excuse me. In California, we may have a stronger protections than some other places, especially for LGBT communities and immigrant families, but we are still part of a wider landscape where many people live with reduced access and heightened their risk, right? Our job is not to solve every legal issue, but to help people see the connection between these larger decisions and their everyday safety nets. Who can get care, for example? Who can feel safe at a school? Who can participate in community life? And who can influence policy? So, I want to give you guys a gentle guidance and another call to action, another CTA. If you're watching this from California, know that there are still important protections here, and there are organizations working hard to support the LGBT communities, immigrant families, and young people navigating these changes. And that also includes our African American and Black communities. Wherever you are, a few gentle steps you can take include, now remember, these are our CTAs, call to actions. Stay informed through trusted, nonpartisan sources such as our organization. Okay, connect with local community groups, legal aid, and health services that understand your state laws. Paying attention to how changes in sports participation, school policies, and voting rules show up in your life and in your community. As Project Heal and as pathfinders and community navigators, we'll keep watching how these decisions affect your safety nets and everyday wellness. And we'll continue sharing tools, resources, and global health perspectives that help you navigate your journey. Now, if this update was helpful, consider subscribing and sharing it with someone who might be feeling confused or overwhelmed by these headlines. You're not alone. We're walking this pathway to wellness with you, and we're walking this global to local support journey together. So until then, and I say until then, take care and caring for you and your tribe. and God bless. We'll get through this together.